You're listening to the 123 show with me, Noreen Mayer, on this Wednesday afternoon. Let's turn to our very first topic of today. In the next 15 minutes or so, we're talking about IVF and the IVF process and also the management of expectations. And I'm really delighted to be joined by Dr. Carina Chan, who is a specialist in reproductive medicine. Dr. Chan, good afternoon to you. Thank you so much for joining us today.
Good afternoon, Noreen and everyone.
Yes, so I know this is such a big topic. We were just talking about it.
Yes,
Let's sort of start with the basics. Who should be considering this process of IVF?
Right. So there are practically 6 categories of patients who would be considering IVF. IVF, when it was first developed, it was meant to treat women with tubal problems if their tubes are blocked or damaged. And then quickly it became a treatment for patients with other causes of infertility, like men with poor sperm quality. Yes, and couples with unexplained infertility when we cannot find the cause and they have tried other means to conceive and yet they failed. And then IVF will be the ultimate treatment for these couples. And women with severe endometriosis, if they try other means to conceive, the treatment, the success rate will be unsatisfactory. Or if women are in their advanced reproductive age, they do not have much time to try other means of conception. And then recently, there is another reason for a couple to consider IVF is when the couple, one of them, has got a known genetic disease and they want to check the embryo and see if the embryo is affected by the known disease or not before they transfer a healthy embryo back to the uterus, and it will help the couple to have the baby that is not affected by the genetic disease. So basically it's these 6 categories of patients.
So you can actually perform genetic screening on the embryos before before successfully implanting them back to the woman.
Yes, it is possible.
Okay. You mentioned just now women in their advanced age. I feel like that number changes from sort of
time to time. Yeah. Yes.
What is sort of considered as an advanced age mother these days?
We know that if we look at the IVF success rate, it gradually decreases with the women's age. But the very obvious decrease will be somewhere around the age of 37.
Oh, okay.
So that will be a time when we really want to consider if, for example, a couple with unexplained infertility coming to seek consultation, and then we'll consider whether this age is the right time or about the right time for us to consider IVF directly, rather than trying for other simple ways first.
Yeah. Let's talk briefly about the procedure for IVF then.
Yes.
It's quite a long sort of process. I hear from friends and family, especially if you're going through the public route where there is a lot of sort of screenings and a lot of requirements. But generally speaking, what is the sort of procedure for IVF?
Yes. If you break it up to a few steps, it sounds much more simple,
manageable.
Yes, the first step is to stimulate the ovaries so that the woman will be making more eggs in that particular cycle. So we actually get to have more eggs to work on. So that will be by means of injection, and that will last for a week or so. And then the second step is for us to extract the eggs, retrieve the eggs, and get the eggs out from the woman's ovary. And then the third step is to fertilize the egg with the sperm. And when this process is done, we keep the fertilized egg in the incubator in the lab and culture them into embryos. And then when we have embryos, then the next step, the final step will be for us to transfer the embryos back into the uterus. So 5 steps in total.
Okay. In terms of the egg stimulation, that very first step, is it administered by the doctor, or do you have to do those hormone shots yourself?
Usually, we encourage patients to do the shots themselves
because they know when the cycle are nearing to their own cycle.
Yes, we start the injection on the 2nd or 3rd day of their cycle.
Oh, okay.
In the beginning. Those injections are actually quite simple to do. So we usually teach and let them try it themselves. If they can do it, then they do not have to come to the clinic every day. That saves the patient a lot of time.
Yeah.
Yeah. And it's not that difficult and not that scary.
Yeah, because it sounds sort of scary when you have to inject yourself. Is it
Yes.
painful or is it risky at all?
No. No, it's not. Just imagine, I always tell patients, just imagine a diabetic patient doing insulin injection.
Ah,
It's just
yes.
the same way. So it's a very fine needle, a very short needle, and we're supposed to give the injection to the tummy.
Yeah, just the largest sort of surface area.
Yes, yes. So it's actually quite simple, and the needles are designed into such a way that they're very thin. So practically, when they go in, it's minimal discomfort.
Yeah, and normally, how many eggs would be sort of produced? I mean, normally per cycle, for a typical woman is about one egg per cycle. After these sort of injections, would you be getting two or even multiple eggs?
We want to get somewhere between 12 to 15.
Oh, wow.
Yes.
That's a lot.
Yeah, that's a lot, but sometimes
Sounds like a lot.
not
Yeah.
sounds like a lot, but at the end, it's not really that many. And but sometimes some women may not be able to give us that many. That is the problem.
Yeah. And do you sort of screen the quality of eggs or, are all eggs sort of created equal?
We do not screen them, and
Yeah.
we do not choose them.
Yeah.
Because we do not have that many eggs, so we will give every egg the best chance to grow into an embryo. And then we select embryo quality, and then it depends on the quality of the embryo. We select which one to put back into the uterus.
Yeah. What's the sort of basis of the quality of embryo? What makes a sort of good quality embryo?
It depends on the speed of the growth of the embryo in the lab. So there are scoring systems
Oh,
for
a
embryos.
scoring system.
Yes, yes, but we do not have a scoring system for eggs. We do have scoring systems for embryos. And the embryos, when they are kept in the incubator, they can be kept for a maximum of 5 to 6 days. So the first scoring system is the system that has been in use for many, many years, and that actually score day 3 or day 3, day 2 or day 3 embryos. We call them cleavage stage embryos. And that is how many days they are outside the woman's body.
Oh, wow, this is
So
so
that's day 2,
fascinating.
day 3. So if we take the eggs out, we keep the fertilized egg and subsequently the embryo in the incubator for 3 days, and then we call this a day 3 embryo.
Okay. And how many embryos can you then successfully implant back to the mother then?
And the first question is how many embryos we
Oh,
have
yeah.
for this particular patient. So
Yes.
that's why if we have more eggs to start with, then we end up with more embryos,
To
and then
choose
we can
from. Yes,
choose.
yes.
Yes, yes. In many places, actually, the maximum number of embryos that can be transferred back to the uterus is governed by law. In Hong Kong, we are also governed by law in terms of how many embryos that we can put back, the maximum number I'm referring to. So in Hong Kong, we can only put back a maximum of 3 embryos.
Okay.
But many a times, we do not want to put that many embryos back because of the possibility of multiple pregnancies or even high order multiples. Like if we put 3 embryos back, if they all work, then we'll be having a
Triplets.
set of triplets.
Yes.
Exactly. Yes. So most of the time, women are actually choosing between 1 to 2.
Yeah.
But still, now the principle is why do some women want to transfer 2 embryos? Because they have a higher chance of pregnancy if they put 2 embryos back rather than putting 1 embryo back.
Yeah.
But there will be a possibility of twins. That is the downside.
Yeah, because are these sort of the same women who have difficulties sort of carrying babies to full term? Are they prone to miscarriages?
And not prone to miscarriages.
Okay,
We are
okay.
worried about if someone is carrying twins, then the chance of this woman having a preterm labor and also other pregnancy-related complications will be higher
Like
as compared.
preeclampsia. Yeah,
Exactly.
sure.
Yes. Yes.
Wow.
So that's why we do not want to see twin pregnancies. And in fact, twin pregnancies is actually one of the risks one of the risks of IVF. We stress this is risks.
As a risk, well, because perhaps some of these couples have tried for so many years to
Yes.
get pregnant,
And they're so desperate.
exactly, and they're just so delighted and over the moon to have such success with the
Yes.
embryos.
Yes.
As a doctor, you know, as a medical doctor, how do
We
you
see
balance
things
that?
slightly differently.
Yes.
Yes.
How do you sort of gently explain to them that perhaps it's not so ideal to be carrying twins to manage that?
Yes, we always explain. And also, sometimes we just have to balance the risk of carrying twins versus the risk of not conceiving after an embryo transfer.
Yeah.
Yeah, so that is a very difficult choice for most patients.
Yeah. And what happens to some of the successful embryos that, you know, don't end up getting transferred back to the mother? Are they able to be stored or what happens to them?
Yes, absolutely. We freeze them.
Yeah.
We freeze the surplus embryos so that in case the first transfer doesn't work, then we still have backup. And the next time round, we're going to transfer the frozen embryos.
Okay.
And which is much simpler. We do not need all those injections, egg extractions, and all that. Yeah. The embryo transfer process is much simpler.
And how sort of, once the embryo gets implanted and gets transferred back to the mother's uterus, what's the sort of follow-up procedure? Does it continue like a typical pregnancy? You know, you see the dating scan, or is there sort of more intense monitoring just to make sure it's successfully sort of implanted?
It is just another routine, I would say routine or normal follow-up. If a woman conceives after IVF, she will just be like another normal pregnant lady going through the same process of antenatal checking and monitoring. There will be no extra additional monitoring that she needs.
Yeah. Well, Dr. Chan, it's so good to focus on so many of the positives. We were talking earlier that, you know, and you would have seen so many couples undergoing IVF will often say it's rather stressful, especially when the cycles aren't successful.
Yes.
How should couples sort of be managing their expectations?
Yes, that's very true. I would say the failure is actually very difficult to accept. Unfortunately, IVF is not, the success rate with IVF is not really that high. We have seen success rate improving over the last 20 years or so, but then it is limited by so many factors, one of them being the woman's age. So there's something that even with science we cannot change. We would say the success rate across the board will be around 30 to 40%. But there's still lots of factors which can affect the success rate, the figures, like the age of the woman, the ovarian function of the woman, how many eggs she can make in that particular cycle, and number of embryos we are transferring. We have just discussed this. And also our ability to select embryos. Do we have the choice? Do we have the ability to select the embryo that we think has the highest implantation potential to put back into the uterus? That will also affect the success rate. At the end of the day, a success is a success. A failure is a failure. It's only 0% and 100% if you stand from the woman's point of view. So it's important that couples preparing through IVF process, they have to realize that IVF success rate has improved, but it is still not a very dramatic number that we're looking at. And sometimes you really have to try a couple of times, at least a couple of embryo transfers before we see a pregnancy coming.
Yeah. So really for couples who are reproductively challenged, if you are considering sort of IVF, really the earlier the better, because time is really not on the couple's side.
No, just give you some figure that you might consider. In the UK, for example, they have like a nationwide statistic, and that will help us understand the success rate better. So in the UK, if you look at the statistic, in 2019, for women under the age of 35, the pregnancy rate for each embryo transfer cycle is slightly over 30%, 32% to be exact. And then if we look at women between the age of 40 to 42, it becomes 11%.
Wow, it drops very dramatically.
It drops dramatically, yes. So that's why we can come back to the same question you asked me earlier. What is the age cutoff for we consider women in their advanced reproductive age? There is actually no definite cutoff. The success rate will just drop gradually. And then a more dramatic drop we can see is starting from the age of 37. And then the second dramatic drop will be at the age of 40.
Yeah. Wow. And IVF can be a very expensive procedure.
Yes.
Also, how many times can you really try IVF until really you should, really not look at this as an option? Or can you, or is it unlimited really?
It is unlimited.
Okay.
But in reality, there will be limitation. Like we're talking about money and also time and also stress related with
expectation
failure.
And the hope. Yes.
Yes. So for women in their younger age group, if they're being young, they have a higher success rate for each transfer cycle. So it will not be that difficult for them to conceive at the end. They may have to try it once, twice, or 3 times. But in women in their more advanced reproductive age, like over the age of 40, they may have to try multiple times.
Yeah.
Or if they're lucky, we have seen patients who are in their 40s and 40 years old, 41 year old, they have a pregnancy even after the first cycle of IVF.
Oh, wow. Yeah. How soon in between IVFs? I mean, with regular couples, if you get a period, you can try again in your next cycle. What about IVF? Is it similar, or do you have to wait longer?
No, you can try the next cycle. You can try every month. But again, there are limiting factors like the ones that we have discussed.
Yeah. Wow.
It's not easy.
Yeah. Do you recommend people sort of taking breaks in between IVF cycles?
Well, it depends
or does it
on...
it depends on their funds and just...
Yes. Depends on how they feel. Money is one thing that we always have to consider, but we always don't forget how the women feel.
Yeah.
As we talked about stress, and you can imagine how a woman feels when she sees that period is coming again after an embryo transfer. That really is psychologically very challenging.
Yeah. I mean, as much as we want to say with couples who are reproductively challenged, sometimes the issue is half and half. Sometimes it may be the woman, sometimes it may be the men, but ultimately in terms of IVF, when the woman then carries the baby and it's not successful, the pressure is, and the stress really can get to you, and you feel like a failure sometimes.
Absolutely. Yes.
Yeah. Wow, Dr. Chan, I learned so much from you this afternoon. I'm sure our listeners did as well. Remind our listeners once again, have you got a website? How can we find out more about you and your work?
Yes. We have a clinic website that you can, we actually have put up a lot of information on the website about IVF. So if anyone is interested, they can take a look and do a little bit more reading themselves.
Excellent. Well, Dr. Carina... Sorry, go on.
It's hongkongreproductivehealth.com.hk.
Excellent. And thank you so much, Dr. Carina Chan.
Thank you, Noreen.
Who's a specialist in reproductive medicine. Thank you so much, and I look forward to having you back on next time. Thank you.
Sure.
Bye.
Bye-bye.